Hope for a quiet summer for COVID is dashed. The virus is raging in the community thanks to the rise of Omicron subvariants BA4 and BA5. OHSU's latest COVID forecast is out. Peter Graven took a few extra days to take full account of the subvariants.
The latest data is definitely showing increases in infections in Oregon. They seemed a little subtle at first. We looked like we had a little plateau, but it's pretty clear we are having an increase right now.
They're as transmissible as measles, which is one of the most contagious viruses out there. I think most people can expect that they will get infected at some point.
Dr. Katie Scharf is Chief of Infectious Disease for Kaiser Permanente Northwest. She says despite vaccines and herd immunity from past infections, she expects 93 to 95% of us will eventually get COVID-19.
All that being said, vaccines are still, the number one tool to prevent severe disease and hospitalization.
If you are in the dwindling group of people who have so far avoided getting COVID, Scharf says avoid crowded indoor gatherings, and if you do end up indoors in a group setting,
one-way masking does improve, the likelihood of staying protected. But if you're going to wear a mask, wear a high quality, KN95 or N95 mask that's well fitted.
The latest forecast from OHSU has COVID activity staying high for the next month, but with hospitalizations peaking July 12th at 479. That does not mean the virus isn't making people pretty miserable.
I have heard anecdotally many people who have contracted this subvariant BA4 and BA5 are having kind of a more severe flu-like illness, not bad enough that they need to be in the hospital, but they do not feel well. Fever, sore throat, feeling very poorly.
So Scharf says, pay attention to your body. It may tell you more than a single home COVID test.
If you have symptoms and you have an exposure and you have a negative home antigen test, you are not free and clear. You probably still have COVID. You just haven't picked it up yet with the home antigen test.
And Graven says there may be some good news coming later this summer, because right now there isn't a new variant on the horizon.
That's the first time we've had that in a little while. Now, I do know that there will be another variant, but we don't really have our eyes set on one yet. And so that's always a little bit of hope.